Nagaland's tally of COVID-19 cases surges with detection of 17 new cases during the last 24 hours, taking the total number of positive cases to 347. State's Health and Family Welfare Minister says the fresh cases were reported from the 448 samples tested. 15 new cases reported from Kohima Quarantine Center and 2 cases are reported from Zinaboto Quarantine Center. Against the backdrop of several incidents occurring at quarantine centers across the state, Nagaland's Health and Family Welfare Minister appeals to returnees staying at various quarantine centers to extend their cooperation to the authority and follow the guidelines strictly issued by the government. Says their cooperation was needed to protect the community from COVID-19. And the country sees the highest single-day spike of 15,968 COVID-19 cases, taking the infection tally to 4,56,183 and the death toll to 14,476. Number of active cases stands at 1,83,022, while 2,58,684 people have recovered. Well, hello viewers, welcome to this news broadcast from News and Trends, and you're watching this daily news bulletin that's coming to you from our studios here in Nagaland. We begin with the latest update from the coronavirus status in Nagaland. State's tally of COVID-19 cases surged upwards with detection of 17 new cases during the last 24 hours, taking the total number of positive cases to 347. The fresh cases were reported from the 448 samples that were tested. State's Health and Family Welfare Minister S. Pangyupom in his tweet this morning informed that the 15 new cases were reported from Kohima Quarantine Center and 2 from Zinaboto Quarantine Center. Meanwhile, the minister informed in a tweet this afternoon that 7 more patients have recovered from COVID-19, 5 from Dimapur and 2 from Kohima. With this, the total number of recovered patients stand at 148 with 199 active cases in the state. The minister also tweeted to inform that the Ministry of Health and Family Welfare had allotted 45 new ventilators to combat the COVID-19 pandemic to Nagaland. He tweeted to inform that the facility will be distributed according to need basis covering the entire districts of the state. He said our effort to avail all basic medical requirement will continue to assure best service. 7 districts in Nagaland, Dimapur, Kohima, Peren, Pek, Mon, Zinaboto and Twensang have reported so far 1 or more cases of COVID-19. As per the data given on Nagaland COVID-19 dashboard, out of the 347 cases, 240 were males and 107 were females. 326 persons, that's over 93% of the cases, were among those belonging in the 18 to 44 years age group. There were 10 cases each in the 0 to 17 and 45 to 64 years age groups. There was a single case in the 65 to 74 age bracket. Now, against the backdrop of several incidents occurring at quarantine centers across the state, Minister for Health and Family Welfare Nagaland S. Pangyupom today appealed to returnees staying at various quarantine centers to extend their cooperation to the authority and follow the guidelines strictly issued by the government. While concurring with the returnees longing for home from these quarantine centers, he said such cooperation was needed to protect the community from COVID-19. Taking to Twitter today, Pangyu said that in this challenging time, cooperation and coordination is an important issue. Therefore, I would like to appeal all the returnees in various quarantine centers across the state to kindly extend your cooperation to the authority and follow the guidelines strictly issued by the government, the minister urged in his tweet. I understand that you all are longing for home, but please do remember that your cooperation is needed to protect our community from COVID-19, he added. The country saw the highest single-day jump of 15,968 COVID-19 cases and 465 fatalities taking the infection tally to 4,56,183 and the death toll to 14,476, according to the Union Health Ministry data. India registered over 14,000 cases for the fifth day in a row and witnessed a surge of 2,65,648 infections from June 1 till June 24, with Maharashtra, Delhi, Tamil Nadu, Gujarat, and Uttar Pradesh remaining the top 5 contributors to the rising tally. The number of active cases stand at 1,83,022, while 2,58,684 people have recovered and one patient has migrated according to the updated figures at 8 am. Thus, around 56.71% patients have recovered so far, an official said. Maharashtra has reported the highest number of cases, followed by Delhi, Tamil Nadu, Gujarat, Uttar Pradesh, Rajasthan, and West Bengal, the ministry data said. In the northeast, Assam has reported 5,831 cases of the pathogen. A total of 1,259 cases have been reported from Tripura. Manipur has 921 COVID-19 cases. Mizoram has 142. Arunachal Pradesh has 148. Meghalaya 46. And Sikkim has reported 79 cases till now. The total number of global coronavirus cases has increased to 92,56,366, while the death toll has reached 4,77,425, according to the Johns Hopkins University. With 23,46,950 confirmed cases and 1,21,228 deaths, the US currently accounts for the highest number of infections and fatalities in the world. In terms of cases, Brazil comes in the second place with 11,45,906 infections. This was followed by Russia, India, and the United Kingdom. Regarding fatalities, Brazil comes in the second place after the US with 52,645 COVID-19 deaths. Back home, the District Task Force Dimapur under the chairmanship of Deputy Commissioner Dimapur Anup Kimchi yesterday decided not to allow footpath vendors to sit below the flyover bridge and Niamo Lotha Road. The decision was taken to avoid rush in the footpath and for maintaining social distance in view of the present pandemic. In the meeting, Deputy Commissioner Dimapur expressed concern about the normal OPD patients suffering from varied ailments like cancer, heart, surgical cases, etc., and felt the need to draw an action plan for addressing the problem. Anup Kimchi also informed the members that proposal for CT scan machine has been put up under ONGC's CSR initiative. Echoing on the same line with the Deputy Commissioner MS Dimapur, Dr. Kheshto Jimomi, while informing that the lone government hospital at Dimapur has been addressing only COVID-19 cases for the past 3 months, felt an urgent need for addressing the plight of normal patients. The members decided to bring to the attention of the government to expedite construction of the 100-bedded abandoned hospital at Chumagedima so that it can be used as Dimapur COVID Hospital and later on can be used as infectious disease hospital as was done in other cities. Director CIHSR Dr. Sedevi emphasized on the need and importance of mass awareness campaign, stating that with reliable information, people would definitely cooperate with the administration. He observed that presently COVID situation are decreasing as all our returnees has come back. However, Dr. Sedevi felt that all the tribes, NGOs, churches, the different Samaj and every part of the society has to be involved for creating mass campaign in educating the people in order to contain the community transmission. This is one area where we really need to step up, he opined. Towards this, the Deputy Commissioner agreed that information must reach all the households and said that all NGOs would be trained to educate the people on the rules to be followed to keep away from coronavirus. It was also decided that border areas would continue to remain sealed. However, students, government employees with ID cards, and serious medical cases would be placed under the category in Borlingri Gate. Deputy CMO Dimapur Dr. Antoli Su also advised for strict monitoring of the border areas in order to avoid community transmission. The Assam government yesterday imposed a 14-day total lockdown in 11 municipal ward areas of Guwahati with effect from 9 pm as there is a large-scale spread of coronavirus infection among people of certain parts of the city. The lockdown will remain in force for 14 days from Tuesday subject to modification as and when required, an order issued by Assam Chief Secretary Kumar Sanjay Krishna said. The lockdown has been clamped in wards of Guwahati Municipal Corporation covering areas like the Kamakhya Temple, Maligaon, Fatasil, Pan Bazar and parts of Fancy Bazar. A total of 250 people reached Dimapur by flight today. According to DIPR, out of 250 passengers that arrived, Air India brought 102 from Kolkata and 7 from Guwahati, while Indigo flight brought 141 from Kolkata. After the medical screening and mandatory procedures were done, all the returnees were transported by buses to their respective quarantine centers. The members of the Kifri District Task Force had a meeting yesterday which was chaired by DC Kifri at the DBDB Hall. The meeting resolved to keep the members of the institutional quarantine without reducing till 15th July. Church organization highlighted on alternative arrangements in managing the food for quarantine centers and understanding the need, the Deputy Commissioner directed the Food Committee to deliberate on the same. The Deputy Commissioner also thanked all the members in Food Committee for their cooperation. DC Kifri Sarita lauded the good teamwork extended by everyone and encouraged all to keep it up. She cautioned on proper home quarantine to contact the concerned authority when needed. The last batch of returnees who were at the institutional quarantine center at Livingstone Foundation International Dimapur left the center today. A total of 62 females left the center after the second tests were conducted and after they had spent 31 days of quarantine at this center. Wearing of masks by one and all has been made mandatory to fight against COVID-19, and people who are not following the guidelines at Dimapur are penalized with a fine of Rs 100. The collected money amounting to Rs 13,500, which was released within 2 days, will be deposited in the government treasury, according to DC Dimapur. In order to create awareness among the public, Dimapur District Administration has, in coordination with DPRO Dimapur, has been making announcements throughout the length and breadth of Dimapur since April 2020 through public address system. Till date, announcement is being carried out reminding the masses for wearing masks covering the nose and mouth, which is one of the golden rule for fighting COVID-19. The citizens of Dimapur has been very responsive and cooperative, and more than 90% of the people are seen wearing masks. However, as per reports, there are still some people, including highly educated ones and shopkeepers, who still takes casually and do not wear masks while going in public places, posing threat to oneself and the society at large. Some people just hang the masks in their ears, neck or keep in the vehicle, which does not serve the purpose. DC Dimapur Anup Kimchi cautioned those people who, even after repeated orders and announcements being made, do not follow the guidelines. A fine of Rs 100 are being imposed and all the names and addresses are recorded, so that sterner action as per Disaster Management Act would be initiated against them if they continue to flaunt the guidelines. He further reminded the people for maintaining social distance and for ensuring proper health hygiene to stay away from coronavirus. Now we at News and Trends would like to inform all parents of school children below the age of 10 that we are organizing a video message competition for the kids to keep them busy while the schools are shut. All you have to do is let your kids take part in this competition to express their views, opinions and appreciation to all the frontline workers in the fight against COVID-19. Prizes will be awarded to the first and second prizes along with 3 consolation entries. For all details, you can visit our Facebook page, News and Trends. All you have to do is shoot the video message on your mobile phones and send them to the WhatsApp number 690-986-4232 along with the name, age, male or female, school, class, place, etc. The last date for entry is 1st July 2020, so do visit our Facebook page, News and Trends, for all the details. That's all we have time for in this edition of News Broadcast, but before we leave you, here's another reminder that you can send in your videos at the WhatsApp number flashed below and be part of this venture of being a citizen journalist. Do let us know what's happening in your village, your locality, or your district or your town so that we can share your videos to the rest of the viewers watching this broadcast. Meanwhile, stay safe, practice safe health hygiene, and maintain social distancing wherever you are. But most importantly, take good care of yourself. Thanks for watching.